Hello, everyone. I'm Dr. Marty Ross. Welcome to another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease, and our discussion is based on your questions. So I'm looking forward to seeing what you have in store for me tonight. As usual, I am creating a recording of tonight's event. So if you happen to miss something, I will be sending out an email tomorrow morning announcing that an edited version of the recording of the an edited version of the recording is ready for you to view. So you will be able to see that again tomorrow morning as well too. So for those of you that are new here, welcome. I see some new names on my board, but I'm also pleased to see there's a number of people that have come back. And I'm pleased because I think that means you're probably getting some benefit out of being here. So I'm glad I'm able to help you. I'm not pleased that you have to keep coming back because you have the illness, though. So I hope we can get you to the point that you don't need to be here with me on Thursday evenings, all right? In terms of how you can participate, there's two ways. One, you could be bold, especially if you're new here on the first time, and actually write a question to me. And the way you do that is on the bottom of your screen, there is a chat box area, and you can write your question to me there. This forum works best for short questions. If these get to be very long life history type questions, I can't take them here. This format doesn't work out well for that. Okay, so keep that in mind. Also, as you're writing your question, if you try to use the enter key to create a paragraph, it sends what you've written to me. And so I prefer that you actually write your questions as a long run-on paragraph, not too long, a shorter run-on paragraph, I should say. And when you're done writing that, then click the enter key to send it to me. When you do click it during the writing of the question, it says multiple parts to me. They get to be very difficult on my end to find the pieces, basically. Okay. All right. The other thing is in that chat box, you actually have there's two icons you can click. You can click one that's a question mark, or you can click the other icon that looks like two chat windows. Two's the one that's the two chat windows. That tends to be the one that I answer most of the questions from. The one that functions as a question mark, I tend not to use. Okay, so just so you know that if you want to have a chance of getting your question answered, all right. Let's see here. Oh, so I know I've been off for a couple of weeks here, but we are now scheduled for 3 weeks in a row, counting tonight. So I hope to see you tonight or next week after tonight's webinar as well, too. All right. So let's go ahead and get started here. Hello, Zainab. Let's see. How important is it to take herbal remedies 3 times a day? Could I condense them into larger doses? So, in my protocols, I emphasize doing your herbal antibiotics twice a day, not 3 times a day for most herbs. Okay. So most herbs would be things like cat's claw, you can even do teasel twice a day if you do teasel in your protocol. Things like the only Japanese knotweed, Sida akuta, those would all be generally twice a day. The only ones that I really recommend 3 times a day are cryptolepis. And then also if you happen to use a mixture called biocidin, I like to do that one 3 times a day too. They're more effective. Those two are more effective if you use them 3 times a day. However, if it's just too hard to get that third dose in, often what I'll do is I'll take the total daily dose and split it into 2 parts. Okay, so for instance, when I'm treating Babesia with cryptolepis, my recommended way to use cryptolepis for that is to take a teaspoon, which is 5 milliliters, 3 times a day. And if you wanted to consolidate that down to twice a day, you would do it as taking 7.5 milliliters or a teaspoon and a half twice a day. Okay. Now keep in mind, that's how I use it when I'm treating Babesia. When I'm using it to treat Bartonella, or I'm using it to treat Borrelia, Lyme, in those situations, I'm going to dose it at my total daily dose is going to be, well, actually, I dose it as a half teaspoon 3 times a day. So the total daily dose would be 1.5 teaspoons. Okay. And you would need to divide that into 2 then, basically. Okay. All right. So that should give you some ideas there. Okay. All right. Good luck to you. Hello, Jim. I'll see hi, Dr. Ross. Thanks for these great webinars. You're welcome. I'm wanting to put together a BART protocol without antibiotics while at the same time augmenting the herbs. This is because I can tolerate the herbs only to a limited degree. Can you suggest a protocol that would incorporate herbs plus perhaps diflucan and or methylene blue? Also, would diflucan and methylene blue together be an effective protocol? And can you tell me how hard diflucan and methylene blue are on the microbiome compared to antibiotics and herbs? Okay. So in terms of protocols that you can use that are not made up of traditional antibiotics, I think that's what you're trying to ask here. One of my favorite protocols actually is a methylene blue fluconazole or a methylene blue itraconazole. Itraconazole is in the same family as that fluconazole is, okay? And I have found those regimens to be most useful, especially at clearing the mind, to getting that brain fog to lift and getting your thinking to go again as well, too, all right? And yes, you can use both of those together. Now, diflucan, because it tends to be more antifungal, except we know that from lab experiments, it's very useful against growing and persister Bartonella. Okay, well, actually, a member of that family. Diflucan was never researched itself, but lab experiments were done using a brother or sister of diflucan called clotrimazole, and clotrimazole looked great in the lab. And so, but it's not available in a pill form. So therefore, I started using fluconazole, and a number of my colleagues did too, and we see great benefits. So it's useful for growing and persister Bartonella, okay? And generally, I don't find that it disturbs a healthy microbiome. The only thing it may do in a healthy microbiome is there are, so it's not going to alter the bacterial makeup of the microbiome, but there are some healthy yeast, not candida yeast, but a different type of yeast called Saccharomyces boulardii that makes up the intestines, and fluconazole may not be useful against that. So you're going to get maybe some alteration in the intestinal microbiome using a diflucan, but not of the bacterial makeup, okay? All right, then methylene blue, which is, again, not a traditional antibiotic. It's actually a clothing dye that is also used medically. It's approved medically by the Food and Drug Administration to treat a medical condition called methemoglobinemia. And in hemoglobinemia, people's hemoglobin in the middle of their red blood cells doesn't let go of oxygen. And when they're in a crisis and they need that oxygen, we can inject them with methylene blue, pharmacy grade methylene blue, and it will bump that oxygen off, okay? Now, methylene blue, because it's not a traditional antibiotic, the way we think it works is it helps destabilize the covering, the wall of the bacteria, and that eventually causes the germ to die. So it doesn't work in a traditional antibiotic sense. So I was hopeful that it probably would not alter the bacteria makeup of the intestines. There has been some research that has come out suggesting that it might lower levels of a healthy bacteria called bifidobacterium. And so it probably does do some interruption of the good bacteria load within the intestinal tract, but it is not, in my experience, as severe as what I see with regular prescription antibiotics, okay? So I, these days, think that a combination of an azole like diflucan or itraconazole plus methylene blue, I think is one of the stronger things we can do for Bartonella. That's what I found in my clinical experience, all right? So those could be a good option, but you're not entirely not doing anything to the gut microbiome. You may get some decreased levels of Saccharomyces boulardii, and you may get some interruption of bifidobacterium levels as well too. All right. So while you're on those, I still advocate taking a good probiotic, and if you're having it and making sure you're getting enough polyphenols. Polyphenols are chemicals that are found in coffee, tea, olives, colorful fruits and vegetables. They actually feed your good bacteria. And in addition, there's sugar fibers that we call prebiotics, that are sugar fibers that we don't digest ourselves as humans, but bacteria do. And those type of sugar fibers are found in foods that are rich in fibers. So that'd be your beans, legumes, fruits and vegetables actually are loaded with them too. And so if you have a diet that is heavily plant-based or emphasizes plants, you're probably getting enough polyphenols, and you're probably getting enough prebiotic fibers in there as well too, okay? But if you don't have a plant-based diet, consider getting on prebiotics and consider being on polyphenols while you take your diflucan and methylene blue, even though the chances of them causing some disturbance of your gut microbiome is a lot less, okay? And probably consider being on a probiotic as well too, all right? All right, so in terms of what do I recommend for a polyphenol, there's a product that I carry at my store, which is called Polyphenol Booster, and that is made by a company called Pendulum. And then there's also a prebiotic product that I carry at my store called Mega Pre, and I'll show you those later here in a minute. I'll also show you an article just about gut health in general, okay? All right. Then, in terms of other ways you could go, if you can't do the methylene blue and the fluconazole, then the herbal ways that I would approach Bartonella, there's a few ways you could do it. Number one, you could do a combination of Sida acuta, Houttenia, and then combine those with something called liposomal cinnamon, clove, and oregano, okay? The cinnamon, clove, oregano has laboratory data showing it's very good against hibernating persister sleeping forms of Bartonella, while your Sida acuta and the Houttenia likely go after growing forms, but there's been no studies done telling us whether they go after the hibernator persisters or not, okay? All right. The other benefit of doing that cinnamon, clove, oregano in there is it actually helps break down biofilm slime layers as well too. And as a side comment, your methylene blue in that methylene blue diflucan protocol is very effective against biofilms as well too. Okay, all right. Another alternative herbal protocol that you could do would be a combination of cryptolepis and a Japanese knotweed, and probably add in the cinnamon, clove, oregano on that. There is some good data showing that those are very effective. That combination would be effective against Bartonella. Pick up some Babesia with the cryptolepis, and would be a very effective combination for Borrelia as well too. So that is a combination. If you're looking for a 3-herb combination you could take that would literally target the 3 Bs, I like doing Japanese knotweed, cryptolepis, and the cinnamon, clove, oregano. Okay, all right. Let me do some screen share here. I'm going to show you some things here. Let's see here. All right. Okay, so this is my Lyme information site. And in terms of an herbal antibiotic guide, take a look at here it is. This article called Best Herbal Antibiotic Plans for Lyme, Bartonella, and Babesia. All right. And in here, I outline a number. I provide a table that tells you which herb treats Borrelia, Bartonella, Babesia. In the Borrelia and the Bartonella, it tells you whether they treat persisters, that's the P, and growing forms. Okay. All right. And then in here, I lay out some possible scenarios. And so one of those is Bartonella, Houttenia, Sida acuta, cinnamon, clove, oregano. Okay. I also lay out this Japanese knotweed, cryptolepis, and I should have put the cinnamon, clove, oregano in there too. All right. So that gives you an idea there. And then in terms of if you are not familiar with all these things that we were just talking about with methylene blue and persisters, etc., and you're wanting just to see what are some general antibiotics or herbs you can use to treat Bartonella, take a look at my article here called Kills Bartonella, a Brief Guide, where I provide you a number of possible scenarios, including what I call fluconazole-based treatments, There are down here methylene blue based treatments. And I need to create a separate category, which is methylene blue along with fluconazole. As I worked more and more since I wrote this article, I found that to be a very effective combination. Okay. All right. And then this is my store, Marty Ross MD supplements. Okay. And so in terms of the Mega Pre, this is your prebiotic. Actually shows up twice here. So here's your prebiotic, the Mega Pre, and this is your polyphenol booster that I was telling you about. Okay. So many of you that have seen my webinars know that I have a supplement store. I carry products here to give you an idea what's the best thing that I found to be effective. So what I carry here are things that I used in my practice, and I've spent a lot of time scouring for high quality products. Anyone can purchase here. Okay. And advantages in purchasing from me is, you know, that I've done the hard work of trying to figure out what is safe and effective. Okay. Number two, I price as low as the internet, or as the manufacturers allow me to sell on the internet. Number three, if you have a total order over $50, I provide free shipping. And then finally, I pay for any taxes. If you happen to have them, we pay for them on this end. Okay. All right. So I welcome your business if you're interested in this source for your supplements. Okay. All right. So let me go back here. All right. Good luck to you. Hello. Boy, I know every week I ask how this is spelled. I'll say Allah this time. Okay. All right. Hi, Dr. Ross. Oh, how do you like that? My name is difficult to pronounce, but listen to the Arabic version of Aladdin if you're curious. Oh, all right. I'll have to look at that. Thank you. And thank you for letting me know. I appreciate that. There is no valid test for Bartonella in the UK, and my Borrelia test of IgG, IgMs, I never get the Western blot due to negative ELISAs, rarely show anything. My elispot with Armin revealed borderline Lyme Babesia, but very strong Bartonella. For years, I have been suffering with really bad neurological issues, occipital neuralgia, photophobia, and it was only when I started treatment with doxycycline that I began to experience burning in the soles of my feet. My practitioner doesn't believe Bartonella can be problematic and doesn't agree with Armin Labs results. Let's see, and you ask, are Armin Labs reliable? I know they miss other species of Bartonella, but in my case, mine has been picked up. I have been considering another test to see how my treatment of Bartonella is going. What would you advise for tracking current infections rather than simple, let's see if there was a second part here. A simple exposure and antibodies, you asked. Okay. So, in terms of, is Armin reliable? So Armin Labs runs a type of test, which is called an elispot, which is also known as a T-cell reaction test, okay? And it's measuring whether your type of white blood cells called T cells has ever tried to attack Bartonella. Now, your T cells that circulate in your body that attack germs only live for 2 months. And so if you do a test on the elispot and it comes back positive, that means that germ that you're testing for was in you sometime in the last 2 months. Okay. So positive test means it definitely was there. Okay. But the problem is a negative test does not necessarily mean the germ isn't there. So and the reason is germs can hide. The immune system may not see them. You also could have immune suppression triggered by the germ. So you're not going to have active T cells fighting the germ because of immune suppression. So if you're going to try to do elispot testing to see where you are, it's not reliable. Okay. I can also say the same thing about antibody testing through Western blot or immunoblot methods. You're looking at an immune reaction, And once you got the immune reaction, it may remain even after the germs are gone. Likewise, if you get a negative immune reaction, a negative Western blot, a negative immunoblot, it doesn't prove the germs are gone. You may just have a lot of immune suppression going on, and the germs may be just partying on, having a good time. You could still have active infection. There is only one way. So therefore, there are no reliable ways, I should say, that you can test to see where you are. Okay, there just aren't, unfortunately. Now, is Armin reliable for what it's able to test for? The answer is yes. So if you look at elispot testing in general, and no, Armin has never gone out and done what I'm about ready to say, but if you look at elispot testing, the method of elispot testing, it will find the germ you're testing for, if it's present, about 85% of the time. And when it is present, it is accurate. Okay. So my problem with Armin, and you allude to it here, is that we think there may be 15 or more strains of Bartonella that can infect people. And Armin is only doing elispot testing against one strain. All right. Now, there may be some cross-reactivity between the other strains and Bartonella henselae. However, maybe does not mean there is. Okay. So my problem with Armin, and this is even for Borrelia, is he's not testing for activity against enough strains, basically. Okay. All right. Yeah, I think I answered your question. So there's not another test you can do to see where you are, reliably see where you are. Okay, that's reliable. Okay. And in terms of, is that positive test from Armin accurate? It probably is. Okay. All right. Good luck to you. Hello, Colleen. Let's see. I know you mentioned within range ferritin levels are more important than iron levels. Could you explain more about that? And what is a good level of iron if there is such a thing? Thanks, Dr. Ross. All right. So there's a number of tests you can look at to see what's happening with iron. One of those is your iron level. And there's also something called ferritin. Ferritin is the storage form of iron. And then and so those two tests in particular are what people look at. Okay. The problem with iron levels is you're really, when you do an iron level test, it's measuring what's called free iron, but it's not measuring how much iron is in you, because that would also include iron that is bound to antibodies and proteins. Okay. So what is free in your blood is determined by what your protein supply like and what is your antibody supplies like, basically. All right. So it is not a reliable indicator of what your stores are. And we're more interested in what your stores are. All right. Now, in terms of a good level for ferritin, so ferritin is the storage form, and that's what I tend to track. I tend not to look at iron levels. I look at ferritin. Generally, you want to keep it so it's at least 40. All right. Anywhere between 40 and 80 is fine. You start getting much higher than that, you can get into inflammation actually from your iron. Okay. Now, why is iron important? Well, you need iron to make red blood cells. All right. But you can have enough iron to make your red blood cells and still have low ferritin levels. All right. The other thing that iron's a cofactor, a chemical use, and a lot of our bodily reactions. And it seems that, for instance, for energy reactions, a level of ferritin above 40 is useful. For hair growth, a level of above 40 is useful. All right. So most of us will try to shoot for ferritin levels of about 40 or higher. All right. All right. Good luck to you. Hello, Molly. Let's see. Hold on here just a minute. Hi, Dr. Ross. Thank you for your advice over the last year. It definitely has helped in my recovery. I was diagnosed 10 months ago with Lyme, Babesia, and Bart, and have been on meds since then. I am now walking normally and relatively pain-free. Good, good. I'm glad you've gotten better, and I'm glad that I was able to be part of that for you too. All right. Let's see. My doctor has slowly started weaning me off some meds. I stopped rifampin about 2 months ago and had no ill effects. The only symptom I still have is Lyme arthritis. My tailbone, shoulders, sometimes ankles, toes, and fingers are sore. I read that sometimes the arthritis can linger even if the infection is gone. Is that true? Currently, I take in the morning Tylenol arthritis, nystatin, curcumin phytosome, azithromycin, and methylene blue, Florastor probiotic, trifortified liposomal glutathione, 1 doxy or Bactrim, and 2 vitamin C. In the PM, I take Aleve, nystatin, curcumin, methylene blue, Florastor, doxy, Bactrim, and 2 Simicov oregano. Are there additional? It looks like the last part of your question did not come through. Here we go. I found it. Are there additional meds I can talk to my doctor about to begin to wean off and supplement with additional homeopathic options? I don't want to stop too early, but I also don't want to be on so many antibiotics. Okay. So when you have tick-borne infections, you can have persistent injury, or you can leading to ongoing pains. Okay, so injury that's caused by the germs, injury to the tissues. All right, so you could have injury to the cartilage, you could have injury to your tendons and ligaments that gives you that continued pain. Or the infections also can trigger autoimmune reactions that lead to pain too. It is also possible, even though you're doing better, you still have germ activity going on. And in this forum, I can't ask you a lot of questions to help figure that out. Okay. All right. So there's some comments I'm going to make that you might want to look at in terms of trying to do tissue repair. All right. And so you're on a good antibiotic regimen. It should be effective against Lyme and Bartonella. All right. I assume probably somewhere in the past you dealt with the Babesia. I know some practitioners will use methylene blue for Babesia, but if you look at some of the lab studies, I question the utility of that. Okay. But I would call right now what you're on more of a Borrelia and Bartonella. You're on good agents that will deal with growing and persister. I also like that you are on a number of anti-inflammatory herbs like the curcumin, like the cinnamon, clove, oregano. That should be dialing back some of that inflammation. Okay. But when you're on treatment for a year and you tend to get persisting symptoms of pain, I tend to start thinking of, is there injury to the tissues? So one of the things you can do to repair tissue injury is to use a peptide product called BPC 157. So peptides are basically made up of amino acids, and they need to be about 40 or less amino acids. If you start getting more than 40 amino acids, we call that a protein. Okay, so you can kind of think of a peptide as a short protein, but they're called peptides, all right? Now, there are probably over 100 different peptides that our bodies manufacture naturally, all with certain functions. One of those peptides is a peptide made in the stomach lining called BPC 157. And its job within the intestinal tract is to keep the intestines working and repair injury there. But years ago, athletes discovered that it's quite useful to take in pill forms or even in injectable forms to aid in repairing from athletic injuries. All right. So in my practice, I found it useful for neurologic injury. I found it useful for joint, tendon, and muscle injuries. In addition, it can, based on laboratory studies, can help support your energy factories to work better, called your mitochondria. It also helps balance your immune system so it's less inflammatory and less arthritic. Okay. All right. So the brand I like, the company that manufactures the BPC 157 that I trust and that I've had good relationships with, is called integrated peptides. And I do carry their BPC 157. It's a 500 microgram pill. And I suggest starting at 1 pill twice a day. All right. So I would suggest looking at that and see, if you should start noticing some benefits of it within 2 months. If not, then you probably can consider stopping it. Okay. The other thing you might want to look at too, if mainly it's just the joint pains and inflammations, would be to look at taking, and you would need help with your physician for this one. It's called low dose naltrexone, also known as LDN. So naltrexone is a narcotic blocker and also useful for people with drug addictions, mainly alcoholism, as well as drug addictions. Okay. All right. And so it blocks a type of narcotic receptor we have in our body known as endorphin receptors. And if we block our own endorphin receptors, basically the body responds by decreasing autoimmune style reactions. Okay. All right. In addition, the low dose naltrexone is very useful at getting inflammation under control as well too. Now, if you're going to do low dose naltrexone, again, it's not going to repair the tissue, but if you've got an autoimmune inflammation going on, it can help temper that quite a bit. All right. The way to start low dose naltrexone is to begin at 1.5 milligrams once a day. You do that for a couple of weeks, then you go up to 3 milligrams once a day. And then after another 2 weeks, you go up to 4.5 milligrams once a day. All right. Now, it has to be made by a compounding pharmacy. The companies that manufacture it make it as a 50 milligram pill. But again, as you just heard me say, you go a lot lower doses than that. Okay. So you would need a physician that can prescribe that. All right. So those are two things I would think about doing. I'm not sure what the best way is to go with your antibiotics. I would need to actually ask you a lot of questions. Okay. So let me just show you some articles to take a look at. And this could even be information you print off to bring to your physician if you were to want to too. All right. So take a look at So here's my article on low dose naltrexone. Okay, so you could literally, just go to your computer and do a right-hand click, and then print, and you could print off this whole article. Okay, so it will tell you how LDN works, what to expect from it, and how do you dose it. Okay, and then in terms of peptides, this is my article called Key Oral Peptide Strategies to Repair and Restore in Lyme and Mold Toxicity. And in here, I describe a number of your peptide options, including this BPC 157. And then I talk down here about how do you use it as well too. Okay. And then finally, in terms of the BPC 157, again, here's the product that I recommend. And this is manufactured by Integrated Peptides. Okay. All right. Good luck to you, Molly. And thank you for your question. Hello, Tim. Let's see how Dr. Ross. How are you doing today? I'm well, thank you. I hope you are too. Let's see. I suspect that I successfully treated my Lyme and Bartonella. However, I'm still stuck with Babesia. 2 months ago, my family had COVID, but I'm not sure if I caught it myself. Ever since, I have started sweating during the daytime, while this used to only be a problem while sleeping. Do you think it's more likely that I have a form of unresolved long COVID, or is it more likely that Babesia is acting up? My fatigue and brain fog got worse too. Thank you. All right. So I don't know. And it gets to be a really difficult thing to answer. We don't have reliable blood testing telling us you have long COVID. All right. If I were to be visiting with you in my office, I would spend time trying to understand what your symptoms are overall to help figure it out. So I want to know more about the possibility of Babesia. So sweats can indicate Babesia, but usually it's night sweats that are the issue, not day sweats, okay? Other symptoms that I would be looking at to see that if it indicates you have active Babesia, one of those is having a panic attack anxiety that sometimes fits with Babesia. Another one is having headaches, frontal headaches, or migraine headaches will often get worse with Babesia. Babesia can trigger a lot of imbalance in your adrenaline, anti-adrenaline system. So you'll get periods of adrenaline surges with racing and skipping of the heart. You might also have an imbalance in the ability of your body to maintain blood pressure when you stand up. So you might get faint very easily when you stand up. And then finally, a very odd Babesia symptom, but if it's present, it means something. It means you got Babesia, is some people with active Babesia have a lot of deja vu experiences, like once a day or a few times a week, okay? So if you have a number of those things that I just described, yeah, I would be thinking maybe Babesia, all right? On the other hand, keep in mind that when you have excess cytokines triggered either by tick-borne infections or COVID or long COVID, cytokines lead to sweating, all right? And it can even be during the daytime sweating as well, too. So I can't tell you what's the best way to go here. I would need to try to sit and talk with you and get a much better feeling of what's going on symptom-wise, okay? But could long COVID be doing this? Yeah, it's possible. It is possible, okay? All right. Sorry, I can't give you more help than that, but you should sit down and try to talk to whoever you've seen before that has helped you with Lyme should be able to help you sort through this based on clinical picture and clinical questions and answers. Okay. All right. Good luck to you, Tim. Hello, Carol. Let's see. What do you think causes me to feel horrible when I wake up with fibromyalgia feelings and nausea? It disappears when I get up and move around. I am on antibiotics and herbs for the 3Bs. I can't say which one of those is due to. It could be any one of those could be leading to a lot of inflammation in your body, which for some reason in you're experiencing more in the morning. I don't have an explanation for why that's happening. No, I'm sorry about that. All right. Good luck to you, girl. Let's see. Leslie says she says hi and she's looking forward to the webinar. I'm glad you're here, Leslie. Let's see. Hello, Trish. I have mold colonization. Hi, Dr. Ross. I have nasal colonization and wanted to see your thoughts. This is a compounded medication to be disposed in saline and used with a nasonab. Would you see the steroid there? Is this safe with Lyme? So it looks like it's made up of gentamicin, EDTA, amphotericin B, budesonide, which is your steroid. So it looks like this. So the gentamicin and the EDTA would target a type of infection that's not mold. It's something called Marcons, which is a bacteria infection. I'll say more about that in a minute as to whether I think it's a valid infection or not, but that's what the gentamicin EDTA would be targeting. The amphotericin B is antifungal and therefore would be able to help with fungal infections of the sinuses, colonization. All right. The budesonide is actually quite a small amount and would be probably being used to get inflammation down, especially of your sinus openings that drain through very small openings into your nose passages. Sometimes when we have infections there, you get a lot of swelling, and so therefore the sinuses get plugged up and you can't get medications in. So I suspect that's probably why your provider is using the budesonide. Okay. All right. Now, is that much budesonide enough to suppress your immune system and make it difficult to get over Lyme? Maybe, but, and so the thing about steroid nose sprays, when you put steroid in the nose, it doesn't just stay there. Okay. It gets absorbed into the bloodstream, can get into the body, and might do some immune suppression. I will tell you, it's a very low dose though. So it could be a problem. It may not be a problem. I would not necessarily be using it though. In my practice, I would not do that. All right. So then let's go back and look at the amphotericin part of this and the EDTA. So EDTA can break apart biofilms, which might be useful at helping to get rid of both mold and this Marcon's infection. All right. And then the amphotericin B would be useful at killing funguses. All right. Now, do you need the gentamicin? All right. So let's talk about that. So Richie Shoemaker is a physician that first discovered mold toxicity. All right. And in his theory of mold toxicity, what he would do is he would try to remove mold toxins. And if people did not get better, then he assumed that there was something else inflaming the body. All right. And so he did a bunch of studies and he decided that there is this infection in your sinuses called Marcon's, which stands for methicillin resistance coagulase negative staph. All right. So Marcon's. All right. So bacteria. Okay. The problem is when you treat it, what I have found in my practice is it barely made any difference for anyone. All right. Number two, it keeps coming back. You can't get rid of this stuff practically. You can get rid of it short term, but it'll be back. In the end, many of us think that Marcon's is a red herring. It's probably a bacteria that lives in the noses of healthy people and probably is not causing a problem, right? There's another problem with Richie Shoemaker's theory, and that is Dr. Shoemaker does not believe in chronic Lyme disease. So probably when somebody's not getting better and you've done the binders and not getting better, they may be inflamed more from their chronic tick-borne infections rather than this thing called Marcon's. Okay. All right. The other thing I will let you know, Dr. Shoemaker does not believe in testing for mold toxin levels. And so he doesn't have a reliable way of knowing whether you got those toxins out or not. All right. So anyhow, those are my thoughts on that. Okay. Different providers have different ideas. I can't say your provider is wrong, but I think there is a risk of some immune suppression from the budesonide, a small risk that I don't know that it's warranted. And again, I think Marcon's is a red herring. Many of us that treat don't even bother with it anymore. So I'm not sure that you need the gentamicin in here either. Okay. All right. Good luck to you, Trish. Let's see here. Hello, Haley. Let's see. I was diagnosed with Lyme disease 2 years ago after living with mold. My symptoms began to get better, but now 2 years later are worse than they ever have been. I'm just lost and need help, and I can't breathe and have terrible neuropathy. All right. So, Haley, let me make a comment, and you should. I would suggest you look at something here. Okay. So, whenever you are on herbal or prescription antibiotics, there is a risk that they interrupt your good bacteria in your gut, leading to an imbalance of the bacteria, which is a setup to then develop too many yeast living in your intestines. And you're probably thinking, oh, how does this relate? Just hear me out. Okay. All right. So keep in mind, when you have Lyme disease or you have mold toxicity, the main reason you feel poorly is that both of those conditions trigger your immune system to overproduce a group of chemicals called cytokines, all right? So cytokines are good and bad. The cytokines that get triggered cause your immune system to work better, are designed to help your immune system work better. They help bring white blood cells to where your problem is, and they help those white blood cells work better. That's great, okay? However, in mold toxicity and in chronic tick-borne infections and in too many yeast living in your intestines, your immune system will try harder and harder to get rid of the problems. And when it's not getting rid of the problems, it's going to keep trying to rev up by making more and more cytokines. And those cytokines make it so you can't sleep, make you hurt all over, give you fatigue, interfere with how your hormonal systems work, et cetera, et cetera. So most Lyme disease, Bartonella, Babesia, mold toxicity symptoms are caused by too many cytokines. All right. All right. Now, so if I've seen somebody that I had on antibiotics for a while, and then a year or two later, they come back and see me and they think they've relapsed, the first thing I want to explore, and this is something I found effective 80% of the time, was to see if there's any clues that they have too many yeast in their intestines. Even if they took probiotics, they did nystatin, all these great things while they're on antibiotics, it's still possible 1, 2, 3 years down the road that the microbial imbalance in the intestines that occurred from being on those will lead to problems of too many yeast down the road. Okay. All right. And that can occur years later. All right. So the things to look at are, do you have increased sugar cravings? Did you get worse that was related to having some kind of a big sugar binge, like you were eating cake nightly, or you were drinking 3 glasses of red wine every night, and then suddenly you started getting worse? All right. In other words, did you feed your yeast, basically? Okay. Number 2, any intestinal gasiness and bloating. Number 3, if you happen to have something sugary, do you feel a lot worse right away, practically? Number 4, do you have any vaginal discharge or itching? And number 5, do you happen to notice that you've had worsening skin problems like pimples or acne or eczema type rashes? Okay. So when you have too many yeast in the intestines, they, in addition to triggering these cytokines, they also release toxins that are neurotoxic, which could be why your neuropathy has gotten worse. But also those toxins get into your bloodstream and cause your skin to start having these different reaction kind of problems as well too. Okay. All right. And then let me see here. The other thing I'd point out, if you have too many yeast in your intestines, they trigger a group of cells in your intestines called mast cells to make histamines. And those histamines get absorbed into the bloodstream and float through the body. And at the level of the lungs, in some people, they can trigger an asthma-like reaction, giving you the worsened air hunger, for instance, and the difficulty breathing. Okay. So I would go ahead and I'll show you my article that you can use to help figure out if you have yeast. I kind of just walked you through what the symptoms are you're going to look at. And if you said yes to a number of those questions that I just said, I would spend time treating for too many intestinal yeast for about a month or 2. And I have found that to be that all you need to do about 80% of the time. Okay, that will get you back on your way again, that the problem you're having may not have anything to do with tick-borne infections being active or mold toxicity having returned, if you answer yes to a number of those yeast questions. Okay. All right. So let me do a screen share here. All right. So take a look in my online guide and look at my yeast chapter. And to figure out if you have too many yeast, look through this. A silent problem is a yeast. Okay. Also, take a look at if you do, if it does look like you have yeast based on your reading of that, then here's my article. It's called Kills and Prevents Yeast, a brief guide, where I outline numerous ways to get rid of too many yeast. Okay. All right. And then let's see here. I'm trying to think if there was one other thing. Yeah. Anyhow, I think that'll get you started there. Okay. Good luck to you. Hello, Carter. Let's see, on an extreme budget, what would you start with to treat Lyme and co-infections if you prefer to stick with herbs? What's your opinion on these red light therapies, and have you ever tried any of those with your clients? All right. So I'll be glad to answer all that. So, if you're saying by Lyme and co-infections, I pretty much you probably mean Borrelia, which is Lyme, Bartonella, and Babesia. Okay. And so the 3 herbal antibiotic combination I would focus on is cryptolepis, Japanese knotweed, and liposomal cinnamon clove oregano. Okay. I showed that combination to you earlier in my herbal antibiotic guide. I'll show that to you again here in a minute, but you would want to do cryptolepis if you have Babesia involved at 5 milliliters 3 times a day. The crypto is also useful at treating growing and persister Lyme and Bartonella. All right. The Japanese knotweed is useful at treating growing and persister Lyme and growing and persister forms of Bartonella, and may have some weak activity against Babesia. I call it weak, but it may have some weak activity against Babesia. And then the liposomal cinnamon clove oregano is useful at removing biofilms, and it's useful at treating growing and persister Lyme and Bartonella. All right. And that would be 1 capsule twice a day. The Japanese knotweed, I should have mentioned, you would dose at 30 drops twice a day. Okay. All right. In addition, so that's just to get your germs killed. I would also look at trying to get some control on your cytokines, because excess cytokines suppress your immune system. All right. So even if it doesn't make you feel better, I would look at doing curcumin, which is liposomal curcumin is what I like to use. And curcumin is a component of the seasoning turmeric. It gets inside your white blood cells and decreases their ability to produce cytokines. Okay. And so it's 500 milligrams 3 times a day. The product I like for that is a liposomal product, and it's called curcumin phytosome, and it's made by Thorne. All right. And then in terms of red light therapies, I would not say are useful at killing germs. Okay, that's not what they do. Red light therapies are useful at getting inflammation down, particularly athletic-related overuse inflammation. I never recommended them to my clients, okay? And I'm not clear they would make a difference for cytokine inflammation. You could give it a try and see, though. I mean, I don't think you're going to hurt yourself. Maybe it will, maybe it won't. But I wouldn't look at red light therapy as having anything to do with killing germs, though. Okay. All right. All right. So I'm going to do a screen share again here. Okay. So again, in terms of my herbal antibiotic guide, this is it here. It's called the best herbal antibiotic plans for Lyme, Bartonella, Babesia. Okay. Another place to look would be my Ross protocol. And this is my protocol. And these are the areas I suggest you deal with. Okay. But if you have limited budget, I know you may only be able to focus on your germ killers, which are down here, and on cytokine control. Okay. All right. But when it comes to a protocol that can treat all 3, take a look at this option 3, which is my Babesia, Bartonella, and Borrelia treated at the same time. And that's to use your cryptolepis, Japanese knotweed, and cinnamon clove oregano. Okay. All right. Good luck to you, Carter. Hello, Dwight. Let's see. How do you know if you have an internal fungal infection? What are the tests? Are some of the natural herb treatments? What do you to suggest for not being able to handle stress? Even when someone knocks on the door unexpectedly, I just tremble with irrational anxiousness. Okay. All right. So let's start there. So anxiety could be related to tick-borne infections. So both Borrelia and especially Bartonella can lead to ongoing anxiety. So in terms of looking at what you're doing, I would review Bartonella symptoms. And if you have enough of those Bartonella symptoms, and I'll show you where you can look at that here in a minute, I would make sure you're treating Bartonella, especially with that degree of anxiousness. Okay. All right. Secondly, there are some techniques you can do that fall kind of in are ways of calming your limbic system, which is part of the brain that controls whether you're anxious or not. Okay. And will also help calm your what's known as the vagal nerve system as well too. All right. And so there's some programs that you can look at. You have to educate yourself. These are programs that will train you in techniques that you can use to calm those down. One of those is a program by Annie Hopper, and it is known as the Dynamic Neuro Retraining System, or DNRS. There's another type program called the Gupta method, and it tends to be more of a mindfulness, body, or meditation type reprogram that can be done. And then finally, there's a newer system that a lot of people are using, and I've just blanked on the name of it here all of a sudden. I'm sure. I think it's called Primal Trust. If you were to Google Primal Trust, you will find that system as well too. But these are all systems that are designed to kind of get it so that you're not as trigger happy. All right, by focusing on retraining the limbic system and your vagal nerve reactivity as well too. Okay. All right. All right. And then finally, in terms of internal fungal infection, I'm not sure what you mean by that. You may mean fungus colonization in your nose. Okay. You may mean fungal infection of your intestinal tract, or if you mean in your bloodstream and in your other organs, if you have a fungal infection in your bloodstream or in your organs other than the intestines and the sinuses, you would practically be in the intensive care unit on a breathing machine. Okay, those are severe. And so I doubt that's what you're referring to here. Okay, all right. But in terms of, I would need to actually try to get a better feel of what you're looking at. What do you mean by fungal infection? Where do you think it is, to come up with a way for you to approach it? So unfortunately, I would need to ask you some questions here, and I'm not going to be able to do that. Okay. All right. All right. So let me go. Let's see. I want to do a screen share. Oh, I know what I wanted to look at for you. Okay. So we do a screen share here. No, trying to do a screen share. There we go. All right. So in terms of when somebody has a lot of anxiousness, we often wonder about Bartonella. Okay. I would take a look to figure out if you might have Bartonella. Take a look at my section here called How to Diagnose, and this article here called How to Diagnose Bartonella. And in here, I review the various symptoms that you might want testing, but also symptoms you can use that will help you get a sense of whether you have Bartonella or not. Okay. All right. So read through this article. That'll help you figure out whether you might have Bartonella that's driving a lot of that anxiousness. Okay. All right. The other thing, as I mentioned, with both Bartonella and even Borrelia, what gives you a lot of the anxiousness are the excess cytokines. So if you can work with some of my recommended ways of getting cytokines down, like being on curcumin, you may find benefit. The other way I like to lower cytokines besides the curcumin is to be on liposomal glutathione is a useful way to do that too. So if you're looking at ways of getting cytokine control, take a look at my Herxheimer and cytokine section here, and then take a look at this article called Control Cytokines, a guide to fix immune function and symptoms in persistent infections and mold toxicity. And the two areas I would focus on here is to look at doing my recommendations for liposomal curcumin and my recommendations for liposomal glutathione. Okay? All right. Good luck to you, Dwight. Hello, Jessica. Hold on here just a minute. Let's see. I'm thinking of taking the Lyme 2 tincture, which has Japanese knotweed, ginseng, red root, prickly ash, cat's claw, with my 200 milligram a day of doxy for early Lyme. It doesn't have Chinese skullcap, which I'd like to add. However, I'm low carb keto and historically have been insulin resistant. Will this make my blood sugar too low? So I think you're asking, will Chinese skullcap make your blood sugar too low? I don't think it will. I think you'd be okay doing that. Okay. All right. Good luck to you, Jessica. Hello, Diane. Let's see. How long should you stay on the herbal remedies, especially if you've had these infections for a very long time? All right. So a general rule of thumb in terms of how long do you treat. So in some people, you can get people 100% well. In other people, you might not get 100% well because there could be some permanent injury created from having had the infections. All right. So the way that I decide when it's time to stop is to look at two things. Number one, if I'm able to get somebody so they're symptom free for at least 2 months, then I'll stop. Okay. Because I find it's a low chance of getting relapse in that kind of a situation. All right. The other thing I'll do if I can't get somebody well is I will consider stopping their treatment if I've done about anything I can imagine to move the treatment forward, and they're at a good plateau for 4 months and there isn't anything I can do that will shift them to move forward again. That's a type of situation where you wonder if the germs are gone and all that's left is injury. In those situations, I also will consider stopping the herbal antibiotics. Okay. Now, you may also be saying, how long can you stay on a certain regimen, right? So generally, with herbal antibiotics, I might use any combination that I have a person on for anywhere for 6 to 12 months before I consider changing to a different herbal combination. Okay, that's just a general guideline. The other thing is, if you are doing an herbal antibiotic regimen that targets Bartonella or targets Babesia, for both of those, your Bartonella, if you're on something that is helping it, you should start seeing a decrease in some of the Bartonella symptoms within 1 to 2 months. I didn't say they'd all be gone, but you should start seeing some decrease. And if not, then you may need to consider changing that regimen to something else, okay? And with Babesia, generally, if you're on something that is working well, you should start seeing some reduction in your Babesia symptoms within 1 to 2 months. And if you don't, then you need to think about changing some of that you're on to a different regimen, basically. Okay. All right. Let me see. I think I recently did an article about this. Let me do a screen share here. All right. So let's see, look at my latest article here. Yeah, I mean, this article here, I talk about recovery timelines and what to expect and how do you determine when it's time to stop, basically. Okay. All right. It's a video article. You'll have to actually watch the video to see what I said. Okay. All right. I think that's the one I wanted to look at. Oh, the other one to look at is this one called Finished. And in here, I talk about how do you know when you're done? Okay. All right. Good luck to you, Diane. Hello, Sandy. Let's see. Is there any problem with taking 1 teaspoon MSM with Lyme Herbals, azithromycin, rifampin? Thanks for your response. I don't see a problem with that. All right. All right. Good luck to you, Sandy. Hello, Haley. Let's see. I've been taking a million combinations of supplements and some help for a bit, but nothing treats my condition. It just helps for a bit, and then my symptoms start to get worse. I don't see a question in that, so I'm not sure how to respond to that, Haley. Maybe I'll find the rest of that here. Let me see if there's something else you wrote. I don't see another part to that. I'm not going to be able to answer that. Hello, Nicole. With neurologic symptoms of atrophy and weakness, is disulfiram more dangerous or can it still be a safe option for treatment? So I have to be honest with you. I think there are better things you can use than disulfiram. All right. And in my practice, there were two groups when I was using it regularly in my practice. There were two groups of people that I really was hesitant to use it in. Number one, people with severe psychiatric problems, because disulfiram can make that a lot worse. All right. And number two, people with neurologic injury already and or neuropathy. And the reason is there's about a 10% chance that people have to stop the disulfiram due to worsened neurologic symptoms. And there is a subset of people that the injury created by disulfiram becomes permanent. I have had people that were seen by other physicians, not me, that were on disulfiram that wound up getting severe neuropathy and neuropathic pain that did not get better when they came off the disulfiram and it became a permanent injury. So I would encourage you, if you've got neurologic symptoms, especially atrophy, which usually means you've got decreased nerve signals to your muscles. With decreased nerve signals to your muscles, they're not going to maintain their mass. Okay. I think I would be hesitant to use this in you. Okay. All right. Good luck to you. Let's see here. Hello, Sandy has a part 2. Also, what probiotics would you use with a Bartonella protocol with antibiotics? So, it depends. If you have, I'd like looking at probiotics as a preventive when you're on antibiotics. In other words, preventing bacteria imbalance. All right. And there are two general probiotic I would suggest starting with. Number one could be a spore forming probiotic. Spore formers are bacteria that come from the soil, when we take them, because they're spores, they easily get through the stomach acid down into the intestines, okay? Now, in the intestines, they don't actually implant themselves, but they send signals that help the existing bacteria to grow better and to work better, basically, okay? So that's how they work. Generally, I recommend spore-forming probiotics if you're somebody that doesn't have existing symptoms of leaky gut, meaning your intestines are functioning well, all right? Symptoms of leaky gut, which means you've got already imbalance in your intestines, would be things like cramping, gassiness, and bloating, loose stools, etc. In those situations, if that's what you have, then I prefer to have somebody take a different probiotic, and I would use a product called Metabolic Daily. That probiotic has something in it called Akkermansia, and in addition, it has what are known as butyrate producers in it. And the Akkermansia, along with the butyrate producers, works to produce butyrate. And butyrate is very effective at healing the lining of the intestines that's leaking, okay? In addition, the Akkermansia is effective at sends signals like the spore-forming probiotics to existing good bacteria in your intestines to grow better and to perform better, okay? So it works very well that way too. So if you've got a lot of GI symptoms, I would use, to start with, I would use the, it's called Metabolic Daily by Pendulum, and I would start at 1 or 2 pills one time a day. If you do not have existing problems, then I would look at using a core biotic by Research Nutritionals, and you might start that at 1 or 2 pills once a day. Okay. All right. Let me show you an article where I kind of review this in more detail for you. All right. So this is my article on how to keep a healthy intestinal microbiome, even when you're on antibiotics. Okay. And it's a bit of a long article, so you may want to even just print it to read it, or you could go right to the what to do part, okay? But I give you a lot of background here so you can understand what my recommendations are. And I talk about the various kind of probiotics and prebiotics and things you can do to help improve the health of your gut, okay? So then in terms of, there's the Akkermansia I was telling you about. I talk about a number of things in here, but here's my actual guide of what to do, okay? So I go through a bunch of things, and eventually down in here, if you don't have leaky gut symptoms, I suggest being on a spore-forming probiotic, okay? If you do have some leaky gut, I then suggest using this combination product, which is called Metabolic Daily by Pendulum, that has in it Akkermansia, bifidobacterium, and a number of butyrate producers in here as well too. Okay, all right. Good luck to you, Sandy. Hello, Jessica. Can you talk about recommending the 4 to 6 week ILADS doxy protocol over the 3-week IDSA protocol? I potentially have early Lyme, only rash right now, no other symptoms. And my dermatologist just prescribed 3 weeks of 100 milligram doxy twice a day. And I'm thinking of asking for more. However, I'm worried the impact to my gut and other side effects since I rarely take antibiotics. Okay, so the IDSA basically recommends short-term antibiotics, and those of us in this situation, and those of us that manage Lyme disease that are not IDSA, know that their 3 weeks has too many too great of a chance of treatment failure leading to long-term Lyme. And so therefore, we recommend the 6 to 8 week protocol. Now, if you get a tick bite and you're not symptomatic, I do think 3 to 4 weeks is fine. Okay. And that's supported by mouse studies, basically. But if you get a tick bite and you are symptomatic, either with a bullseye rash or with other symptoms of acute Lyme, like temperature, fever, aching all over, your best option to make sure you get that treated so that it doesn't become a chronic infection is 6 to 8 weeks. The standard of 3 weeks has a treatment failure rate of 15%, meaning 85% of people, it's great. Once they take their 3 weeks of antibiotics, they'll never have a problem again. But we know that 15% of those people fail and develop chronic Lyme disease. All right, 15%. So as ILADS doctors, most of us don't think that's worth that risk. So we recommend, even though you're correct, there's the risk of your intestinal microbiome, we recommend the 6 to 8 weeks. While you're on your antibiotics beyond the probiotics, you may want to take a look at that article that I was just showing you a few minutes ago. Okay? All right. Good luck to you, Jessica. Let's see. Hi, Carl. Let's see. I've had yeast infection for 37 years, tested negative for Lyme, tried metronidazole, Bactrim, and many diet herbal protocols under a naturopath. Everything helps, but only for 2 or 3 days. What is the most effective yeast deterrent? Okay, so to be clear, you said you've had yeast infection, but I will be on the metronidazole, Bactrim, etc. don't do anything for yeast. So I'm not sure if you're just telling me you also were on antibiotics. Okay. In terms of if you have an active yeast infection, what I'd like to use for active yeast overgrowth is a combination of nystatin and prescription fluconazole. That works effectively about 90% of the time over a 1 month period of time. All right. If I have somebody, though, that has done that a number of times and they're not getting better, then the more powerful way that I like to treat active yeast infections is to use a medication called amphotericin. Now, amphotericin, if you start reading about it, you're going to find some horrible stuff written about it online, okay? And that is because it's only manufactured for intravenous administration. And if you give it IV, it is horribly toxic to the liver, basically, and some of the organ systems in the body. The reason it's only made IV is that it doesn't get absorbed in the intestines, all right? So that's a good thing, because when you're using it to treat intestinal yeast overgrowth, it stays in the intestines and you don't get all the systemic toxicity. In terms of its effectiveness, it will work about 95% of the time. You do need to use it for at least 2 months, though. All right. And it tends to be the most effective thing I have found. All right. So if you have active yeast infections, you could start with a fluconazole plus nystatin, or you might want to just go ahead and use the amphotericin that I was talking about. Okay. All right. So you will need a physician to prescribe the amphotericin, and it's a compounded medication. Let me show you the article where you can get more information here about this. All right, so take a look at my yeast chapter here again, and my article, Kills and Prevents Yeast, A Brief Guide. In here, I talk about what you do to promote intestinal health, including making sure you're getting enough polyphenols and prebiotic fibers, either in your diet or by using supplements. In other words, feed your good bacteria. Okay. I talk about the diets that are best to do this too. I talk about which probiotic you should use, and you should either the spore former or the one with, if you have leaky gut symptoms, using this Akkermansia metabolic daily product that I mentioned earlier. Okay. And then finally, you need to kill. All right. So you can either do a fluconazole, nystatin. There is an herbal combination you can use too, but these will take longer and they are only about 80% effective. All right. And then here's the amphotericin B that I was telling you about here. Okay. All right. Good luck to you, Carl. Hello, Valerie. Hello from Marble Falls, Texas. Well, hello, y'all. I'm sitting over in Austin, Texas. You may know that. So you're in my neck of the woods. I actually ride a big Harley, and I like riding from Cedar Park out to Marble Falls. I love that. It's a beautiful ride. So you live in a beautiful area, as far as I'm concerned. So glad to see you're here. Let's see. First time chatting with you. My 21-year-old was diagnosed in June, but I think she's been suffering since age 14. She has so much pain everywhere. She says, my body hates me. Ooh, Valerie, I'm not sure whether, let me see if there's another part to your question here. Uh-oh. Let's see. I think I see another question here. Let me see if this. So it says the pill burden, recovery was diagnosed. Eating disorder, which means whatever we can get her to eat, we have to. So she does have sugar, breads in her diet, as well as with Babesia and Lyme. Newly diagnosed daughter, so frustrated with all the pills. She has pain everywhere. She lives with her heating pad. She dropped out of college last spring and is trying again. She has 4 classes. I think she should only do 3. It just feels like nothing is working for her pain. She is missing class and life. It's all she can do to shower and make a meal help. All right. So I can't give you specific recommendations because I need to know a lot more. I'd have to do a lot of question and answering with you. Okay. But I'm not sure if you know this, but you have a very good Lyme doctor in your backyard. All right. And she's also useful in dealing with young adults and even children with mental health issues as well too. And that's Dr. Amy Offit, and she does practice in Marble Falls. So you might want to, I would suggest that you, if you're not seeing her, that you try to get into her clinic. The situation you're in is going to require pretty close guidance by a physician that can help dissect what's going on and come up with some good recommendations. And generally, I think Amy, Dr. Offit, does a good job. Okay. So she is in Marble Falls, and I would suggest taking a look at her. Okay. All right. Good luck to you and your daughter. Hello, Sandra. See, thank you, Dr. Marty. You're welcome. A few questions. Recently, I had COVID, and it seems to have caused more Lyme and or Bartonella symptoms. I'm not sure if my symptoms are mostly Lyme or COVID. My main symptoms are neuropathy, heart racing issues. I have been told ivermectin may help from my LMD instead of doxycycline. I was told ivermectin works for Lyme too. It seems like a dysautonomia issue that's gotten a lot worse. I also have aching as well. Thanks so much for your thoughts on ivermectin. All right. So ivermectin is a drug that is approved as an antiparasitic. Okay. Just going to start by saying that. All right. That's what it's approved for. In terms of whether it can kill Borrelia or Bartonella, there is no scientific data at all. No one has done any studies either in a laboratory or in a person and then saw what happens with them. to say that ivermectin works. Now, I do know that there are a number of people that may feel better on ivermectin when they have Lyme, but there's another effect of ivermectin, and that is it's a very good anti-cytokine medicine. It actually modulates the immune system reaction. Okay, so in terms of it being an effective germ killer for Lyme, there's no data to suggest it. People may feel better, but that doesn't mean they're getting their germs under control. It just may be getting the inflammation under control. Okay. All right. Then, in terms of COVID, it's a can of worms area, right? So, in my review of acute COVID, I know there were many people that were claiming ivermectin was useful, but on the whole, as I look at those studies, the ones that suggest benefit were highly biased in their research design by predominantly cheerleaders of ivermectin and that it would work. And so in looking at a lot of the results of those studies, they're suspicious. All right. That's for acute. All right. But for long COVID, it is possible that people with COVID, one of the problems can be they have reservoirs of infection still. And ivermectin may be useful in that situation because it, number one, it can balance out those excess cytokines, as I mentioned. Okay. Number two, you may be familiar with the idea of COVID having this spike protein that attaches to your ACE receptors, right? It seems that ivermectin may have the ability to attach itself to the spike protein, making it so that these reservoirs of COVID cannot infect cells. All right. So they eventually get trapped in their cells and may die in there. So it may make it so that it can't spread. And I think there's some compelling data behind that. Okay. So anyhow, I hope that gives you some thoughts on that. Okay. Good luck to you. Let's see. All right. All right, everyone. I was just looking. I'm looking briefly at some of these questions. I'm afraid they're going to go longer than I have time for tonight. So it's about 7:27. I'm actually going to call it quits here. All right. It's been good being with you here tonight. I will be back at this again with you next week. So tomorrow morning, you will get an email from me in the morning, and it will announce that the recording is ready to be watched. But also it will have the ability for you to sign up for next week. Okay. Now, for those of you that want more interactions with me than you can get in these weekly free webinars, I'm going to give you an option that you might want to take a look at. Let's see here. All right. So you can find information. I have an online membership group called Lyme United. All right. And in Lyme United, you have the ability to interact with me and many other people in our community on a regular basis. All right. So for instance, so I have a whole video that walks you through what groups we have and how Lyme United works. All right. And, but within here, there's two main ways that you can interact with me on a regular basis in Lyme United. Number one, each week on Tuesdays, I host a Zoom room event, which is called Ask Marty Ross MD Live. And in there, you can ask me any questions, and I can ask you questions too. So it's a better give and take than we get in this forum. Number two, I have an area within my community, which is called Office Hours with Marty Ross MD. And so on Monday to Friday, between the hours of 12 and 1 p.m., Austin, Texas time, I write responses to any questions that people have written to me over the last 24 hours. So daily, you get a chance to ask me questions, and daily I respond. Okay. All right. Within this community, also, there's member-to-member discussion area. Some of our members periodically will put on events and that members can learn from. But I urge you to take a look here. If you don't think you're getting enough from me and my free weekly webinar, this is another place for you to come and have more interaction with me. And I welcome new members here. All right. All right. So that's it. Good night, everyone. I look forward to seeing you next week. Okay. Bye-bye.